Good morning. Today we're going to talk about the costs of Medicare. In our first session, we talked about the parts of Medicare, and just to review, Part A is hospitalization, Part B is doctors and outpatient services, Part C is the Medicare Advantage plan, and Part D is the prescription drug plans. If you have Part A, and you get it while you're employed or you get it when you're first 65. Part A has no cost if you have worked 40 quarters. Part B has an annual premium and it's split out monthly. If you are on Social Security, that premium is taken out of your Social Security check automatically. And for 2023, that dollar amount is $164.90. So there's nothing that you can do to prevent paying a premium on Part B unless you are on Medicaid. That will be billed to your Social Security, or you will get a quarterly bill from Medicare that says you owe them for either 3 or 4 months. Part C of the legislation has no cost, but there are plans associated with Part C. And again, those are advertised on TV very heavily. You can get as little as a 0 premium, or you can go as high as $180 or more on a Medicare Advantage plan. And then Part D varies. There is no Medicare Part D premium unless you have a high income, in which case there is an additional premium assessed to you based on your income. But typically a Part D premium is going to cost you somewhere between $5 to $7 up to $100 a month. And it's based on where you live, what drugs you're taking, what drugstore you go to, and that is how the pricing is determined on how much you're actually going to spend. That's the cost of Medicare itself. And then you are either going to add a Medicare supplement and a prescription drug plan to it, or you're going to have a Medicare Advantage plan. Those are the two coverage choices. And each one of those has a different price tag associated with it. A Medicare supplement has a premium for women around $110 a month, and for men about $120 a month for a Plan G. But again, it depends on where you live, because premiums in Florida typically are higher than they are in Ohio, for example. So it depends on where you live, because those premiums are based on the zip code that you live in. The same is true for a Medicare Advantage plan. Those plans are filed as individual policies, and they are based on where you live. And what you spend on a Medicare Advantage plan depends on the drugs you're taking, whether or not your doctor's in network, whether or not your hospital is in network. So it's always important when you're making a decision about Medicare coverage to talk to you and can help you make the right decisions for your Medicare coverage. That's all for now. We'll talk to you again soon.